Hello and namaste, guys. I am Dr. Anushruti and I welcome you all to yet another episode of the Dr. Anushruti Show. Today on board, I have the honor of hosting Dr. Vivek Shrivastava. He is the head of the Department of Physiotherapy at Fortis Shalimar Bagh Hospital. Dr. Vivek Shrivastava is renowned for his exceptional skills in physiotherapy with years of experience in this field. He is not only a highly intelligent and skilled practitioner, but also a very compassionate doctor. Our today's topic is dynamics of rehabilitation in spine surgery patients. Well, with this note, I would like to invite him and I would request all of you to give an ear to him. Hello, Dr. Vivek, how are you?
Hello, Dr. Anushruti. I'm fine. Thank you for inviting me on this platform. It's a wonderful initiative you are taking, very, very fruitful, and I expect very good outcomes from this for our physiotherapy audience.
Absolutely. Sir, before we start, I would like you to tell our audience whatever rehabilitation we are going to discuss in the further episode. Is this only for the IPD patients, the in house patients, or also for the OPD patients who come independently to an OPD?
So the principle which is prevalent for the rehabilitation of post spine surgery patients, that principle is applicable for IPD as well as IPD as well as OPD, and also the patients who have undergone surgery post discharge follow ups. That same principle is valid for everyone.
So, moving ahead with the very first question that everyone wants to know, how soon after a spine surgery the rehabilitation process can be taken place?
So the rehabilitation in our hospital at Fortis Hospital, Shalimar Bagh, it starts immediately after the spine surgery. In fact, those patients who are ready, who are open, we recommend rehab to start pre-surgery as well.
All right. So, do
So
you
immediately day
yeah.
zero, so more specific, day zero, the spinal rehabilitation starts.
And how does the initial phase, the initial stage of rehabilitation looks like? What are some exercises that takes place in it?
So mostly on day zero and day one, it's more of positioning and more of activating the lower limbs. That is what comprises us. So positioning, weight bearing, all these things are there in the first day. Not much of mobility, but yeah, we day two, day three, we start that patient. They start they start their weight bearing.
And sir, how does rehabilitation plays a role in pain management post-op?
Yeah. So the one very unique thing which we are practicing in our hospital, what happens is after the surgery, like laminectomy or whatever the categories of surgeries are there in that regime, what happens is after spinal decompression in all hospitals, after most surgeries, if you get it done by a very good surgeon, an able surgeon, what happens that post spine the release, the patient gets immediate relief from their pain. So in fact, in my father's case, he was also disturbed by this back pain and nerve compression was there. So when I went to him after the surgery, or when you go to such patients after the surgery and you ask them that how is your pain, so when I asked my father how is your pain, he said after 3 years I am feeling relief from this pain. And I can't tell you how much relieved I am, because I very well remember his condition, because he was 73 years of age when his spine surgery was performed. And he was a critical case because he had his lungs, he had been put on ventilator some years back after that. So any surgeon was not taking the initiative of performing his surgery. So finally, he was in so much severe pain that he couldn't even move on his bed from his supine condition. So finally, he decided, I am not going to live with this pain. I am going to either I'll get relief from it, from this pain, through death or through surgery, any of those two. And then he took a bold step. He got the surgery done, and the surgery was successful. And immediately after the surgery, he reported to me that he is uh, painless, pain free. Okay, so this, there is there is an apprehension in people of low back pain, that if we get the surgery done, it will be difficult. So this is chapter 1, this is part 1, this is the episode 1, that immediately post after the surgery the patient gets relief. Now the second stage comes. So 15 days pass, 20 days pass, or 3 weeks pass, and in most of the hospitals in Delhi and elsewhere also, they have a post spinal surgery rehab, okay, which starts like SLRs or basic exercises of the spine. That is all good, but most of these patients, after 3 weeks or 4 weeks, they come back again. They
Yeah.
say that our back pain is coming back again. And that is where the complication is there. And that is why these spine surgeries, they are defamed so much, because of that pain which comes up after 1 month. Because many of the rehabilitation professionals and many of the hospitals, they are still not able to crack the issue of this back pain problem. That is the devil there. And that is where we have to target it.
Absolutely. And I feel the living example which you just gave would have turned off so many fears out there who are listening to us, because people eventually have this fear of getting the surgery done. And when the first step is not done, we cannot talk about the rehabilitation process. Moving on, Dr. Vivek, can you tell me how long does a rehabilitation process takes for a person to get actually fit and actually rid of pain?
Yeah. So what? This is a 2 episode pain relief, right? Number one, the immediately after spine surgery, the patients immediately get relief, and because their nerve is decompressed, now the nerve is free, so that radicular pain, it goes off. But that radicular pain has a big history behind it. Now, why this radicular pain is coming, that's a topic of really real analysis. And to get rid of, radicular pain goes off, but after that 3 weeks or 2 weeks, and some people after 2 weeks only the pain comes up again. And where is that pain comes up? Because when these patients come up back to the neurosurgeon and they say, you did surgery, you took so much of money, and why is this back pain coming up again? So their MRI is done, a repeat MRI is done, and the MRI clearly reflects that there is no nerve compression at all. Spinal canal stenosis, everything is resolved. Then why is this pain coming up? And that is where the role of physiotherapist comes up. And not only a physiotherapist, an expert person needs to handle that. So this is where the story of the muscle function comes up. The concepts, the principles of muscle operations and muscle functions come up, and that is where the physiotherapist needs to understand which muscle, because every day, in our OPD and in our IPD, we have, so every day about 5 or 6 spine surgeries take place by our neurosurgery team, and those patients get referred every day. So 5, 6 patients, every new cases come to us for resolving these issues, and all of them have a different picture. Believe me, all of them have a different picture, because what happens is that um, uh, it is very difficult to predict which muscle is undergoing restriction, which muscle is undergoing malfunction. That is where the acumen of the physiotherapist matters a lot. So your question is how long the rehabilitation process is there. I would not like to specify this answer that this much duration. It depends from case to case. In some cases, if the muscles, the complication posed by the muscles involved is less of the muscles are involved, it can resolve in like 1.5 or 2 weeks, or it can extend up to 6 weeks as well. I've seen those cases also.
Absolutely. Sir, we have to know one thing, that is about ambulation. Many people are saying
Ambulation.
that after
Okay.
surgery, would be able to walk? Walking is the main concern. We have seen so many patients discussing and having a query that, okay, I would not lift heavy things, I would not bend down, but make me give me the surety of walking. So as a physiotherapist, as a rehabilitation expert, what is your views on it, or what do you wish to say to the patients over here listening to us about ambulation?
So let me tell you, all the patients coming to us in our hospital post spine surgery rehab, all the patients are not only walking, they are doing much more than walking. So in my case, like my own father's case, after the surgery and after his second episode of rehab, he was walking 1.5 hour in the morning and he was walking 1.5 hour in the evening. That was the capacity of walking he developed after that. Who
After
was not able to move from his bed an inch also. That was even very painful. And
that,
still he
it's
till
great.
date, yeah. So all patients, they can walk. They can do much more than walking. It's not just walking. Yeah.
That is great. And do you feel that there is some particular patient that can have a better rehabilitation criteria? As in, we have seen a lot of patients who are overweight, who are underweight, and people from different nationalities. So, does these factors affect the rehabilitation process?
I my perception is overweight or underweight is not the issue. The muscle health is the issue. If the
Hmm.
muscle health is not proper, muscle health, if the muscle health is not proper, that is actually the issue for rehabilitation. So that needs to be taken care of. And what are the factors affecting muscle health? So the quantum of protein which is there in the individual, the electrolyte balance which is there in the individual, the quantum, the vitamin D levels in the patient, the calcium levels in the patient, the phosphorus levels in the patient, all these nutrients, macronutrients, minerals, vitamins, and the past exercise schedule, like pre spine surgery exercise schedule, what was that of the patient, the the is the muscle hypertrophied, hypertrophied. Those are the factors which actually determine the quality and the extent or the duration of rehabilitation after the spine surgery. It has nothing. My personal belief is, I mean, people may
Hmm.
vary on this point, but my personal viewpoint is that muscle health is the most important thing. It has nothing to do with the weight of the person.
Absolutely. So, here I would like to introduce you to one of my segments of the show, that is Ask the Doctor. Now, I have a few questions ready with me for you, which the patients, the general audience has given me to ask you. I do hope that you will answer it. So, the first question coming up on your way is from, okay, it is from Meera. She's from Chennai. She wants to know, can I continue working while undergoing a rehabilitation program, or should I take a whole break?
Okay. Um, See, to answer, this is a very broad question. It has a very
Hmm.
broad spectrum to answer. And to answer this question, I would like to know more dynamics about her case. So before giving any advice about her, to her, I would consider some of the following points. Like, has is there a case of nerve compression in her case? Number one. Number two, what are the activities or what are the work activities, the profile of work activities which she would like to do? And third, her muscle health status, the nutrition, these points which I discussed just a while ago. These two, three components need to be assessed for her. Without assessing all those points and her age, and all those criterias, we need to assess them first, and then we could advise her, if she can work during her rehabilitation or not. And then, rehabilitation, is it post spinal surgery rehabilitation? What is the kind of rehabilitation she's taking up? That
Hmm.
also matters a lot.
All right. Moving ahead, we have a question from Rohit, who is from Bangalore. He is asking, Sir, are there any specific signs that I should watch for that might indicate a problem during my recovery?
So I guess this is recovery post spine surgery. Is he
Yeah.
asking the question
Yes,
about?
yes, yes.
So number one, if number one is see, every surgeon is has their own protocol and their own criteria for post spine surgery rehab. So the first person to whom they should consult, the do's and don'ts is their spine surgeon. What is their protocol? Okay, every surgeon has their own. So we should respect the that protocol of the surgeon. Secondly, uh, if um, uh, if you have a problem, reach out to your surgeon, check out with, if investigations required and MRI is required, then check out if nerve compression is still there. If the nerve compression is not, if the nerve compression is there, then seek out the solution to your surgeon. If the nerve compression is not there, then seek out to a physiotherapy professional who can analyze the status of your muscle health,
Mhm.
your muscle hypertrophies, the muscle adhesions, the muscle functions, the muscle guarding phenomena. All those criteria need to be properly assessed, and then the further activities can be planned out. That's the thing.
Absolutely. I hope Rohit feels answered. Next, we have Kavita from Jaipur. She is curious to know how can diet and nutrition impact my rehabilitation and recovery post surgery?
Oh, it's the most important thing. Diet and nutrition for the muscle is very, very important.
And I
So
feel
as
this
I
is
was
the most neglected as well.
correct. So, as I was discussing some minutes ago, your vitamin D level, your protein level, your electrolyte level, your calcium level. So calcium comes in the electrolyte only. These four areas, they should be very well taken care of. You should focus on your diet. You should take lot of proteins in your diet. If you are a non-veg, then you have protein sources. If you are a vegetarian, you should eat lot of. And what I recommend to my patients is, just if even if you are a non-veg, you should not just take non-vegetarian sources of protein. You should even have, so protein should come from varied sources. Like you should have sprouts, you should have cheese, you should have soya chunks, you should have peanuts, sprouted peanuts. Protein should be added inside the body from multiple sources, not just one source, that is non-veg, because every protein has their own the contribution and combination of amino acids. So those all those different combinations are needed for different areas in our body, and they should be taken care of. Secondly, electrolyte. So when my patients come to me and they ask, so we advise them, take one coconut water daily, because coconut water, it has all the electrolytes. And of course, you need to check out with your blood pressure levels, hypertension or not. So consult with your physician or your consultant, and if they allow you, do take one coconut water daily. It takes care of your electrolyte needs. And if vitamin D level is there, do check out and take supplements on the recommendation of your surgeon or your consultant.
That is great. Moving on, we have Rakesh, who is from Pune, and he is asking, Sir, what type of a clinic or hospital OPD should I choose? Should I choose a OPD? Should I choose an OPD with lots of machines, new technologies, or a single and simple clinic nearby my home?
Uh, that is for spinal rehabilitation post surgery.
Yeah. Yeah, I feel that he wants to know that people who have done their surgery, who are free from the hospital now for the rehabilitation, because money is also a matter in many cases, if they wish to choose a clinic nearby their homes, so what kind of clinic or OPD should they go ahead with? Ones with a lot of new technologies, new machines, treadmills, weight bearing machines, or a normal, very not so fancy OPDs or clinics?
See, everybody must be having their own opinions. My personal opinion is there. We should approach not a clinic. I mean, clinic is definitely because of the physiotherapist. So one should approach a physiotherapist who very well understands the dynamics of spinal muscles post spine surgery and pre spine surgery. That is the correct person. So then whatever modalities or whatever protocols or whatever exercise prescriptions you use, that's fine. But that person should understand the dynamics of muscle behavior. That's very important.
Well, with this, Dr. Vivek, we have come to the end of this segment. Moving on with the questions directly. The next question coming up on your way is, what are some precautions that people or the patients should take during their recovery phase, during their rehabilitation process?
Okay. As I said, it depends on surgeon to surgeon, but based upon my hospital protocols, initially for some days they need to wear belts. They don't need to take off their belts. Even the exercises which they are doing, they need to do the exercises in belts. At least for first 3 4 days, we recommend in our as the protocol designed by the neurosurgeons of our hospital, they are not supposed to go prone. That is very important. And uh, lastly, no bending, which is a very common advice that should not be done. And weight lifting, all those things should be avoided unless and until your stitches are removed and your wound of the surgery gets healed completely.
And sir, are there any advanced techniques or technologies in the field of physiotherapy that is used or that is very essential in the rehabilitation process, which you would like to talk about for our viewers?
Yeah. So I especially work on muscle behavior, and there are many techniques which I incorporate in my protocols. And I even incorporate some yoga asanas as well in our spinal rehab. Of course, they are prescribed phase wise. So techniques like reciprocal inhibition, irradiation, these are very commonly we use. And co-contractions we include in our spinal rehab protocols. And myofascial release techniques also we use a lot. So these techniques, along with later stages, when the spinal muscle strengthening, and um, and lastly yoga asanas in the later part, to maintain your postural alignment, we do prescribe these as well in our exercise prescriptions.
And are there any lifestyle changes or modifications that patients needs to take during their rehabilitation process and even after that continue keeping it so?
uh, Depends upon the age of the patient, number one. And depends upon the type and extent of fixation which has been incorporated in the person's vertebral column. So all these factors actually determine the lifestyle. So if there is a young patient, and with lot of viability, they can do more of activities. And one thing is very common, the lifestyle, one very common lifestyle change. These problems, the spinal problems, come because of people not doing exercises. Like we brush our teeth every day, like we take bath every day, it's very important to take a bath of a regular exercise program, and an exercise program which is not designed by a gym trainer or any other
Hmm.
unprofessional person. Because in India we have a very big problem. 98% of the gyms are being run, controlled, and advised by people who have no idea about the biomechanics of the body. They have no idea about the clinical outcomes and the physiological and metabolical factors which determine the muscle health. They give the same prescription of exercise for a young person coming of 16 years and a person coming for 30 years. They don't assess them. So, very important lifestyle changes. You need to have a regular exercise program, at least. So, For our patients, we recommend them 3 times a day, and that exercise program should be designed by a clinical professional, a physiotherapist. That's what my recommendation is.
Sir, as a doctor, what would you suggest to the patients? How do they keep motivated during their rehabilitation process? We have seen a lot of patients who are not so interested in it, and eventually, it is a stigma. I would say that they eventually feel that this is a lifelong process and it is never going to end, especially those whose recovery is very slow. So, what is that one view of thing that you would like to let them know so that they can be motivated throughout their journey?
See, motivation comes from results. If you get good results, you get feel motivated. If you don't get good results, if you don't feel that you are moving up the process of well-being, then you get demotivated. So, if you are after post spine surgery, if you feel that you are not going on the right way, like again, you have consulted your neurosurgeon, there is no nerve compression, and then you are following the exercise schedule, then I think it is advisable to revisit your rehabilitation schedule, your exercise prescription. That's very important, because there is no cause. If the nerve compression has been released, there is no reason that your pain should go. Your pain should go, it will go, it has to go, and it will go,
Yeah,
provided you are approaching in the right way. Yeah.
absolutely. Well, as we move to the end of the show, today's episode, Dr. Vivek, what would be your piece of suggestion to every viewer, every listener of this episode?
We must exercise daily. So there are two types of exercises, which this is my, I mean, little bit which I have gathered from the guidance of my teachers and with the experience of my patients. There are two types of exercises according to me, for a healthy individual. Two types of exercises. So one common, जिसको हिंदी में हम भ्रांति बोलते हैं, a misconception. So when patients come, they say, I walk 1.5 hour daily and still I have back pain. I, cycle, you know, 45 minutes daily, but still have neck pain. Why is this so? I exercise daily. This is exercise. But I say that, this is a misconception. So people think that if they walk daily, if they jog daily, if they run daily, if they do cycling daily, they won't have back pain. No, this is not correct. Where is the postural component of exercises? We need to do postural exercises. So that is very important. There should be an exercise schedule in your lifestyle which includes the postural exercises along with aerobic exercise. See, aerobic exercise, I'm not saying they are bad. Aerobic exercise contribute very well in burning your calories, in reducing your weight. They may be a good contribution. But muscle health, that is only done by postural exercises. And the second part which I wanted to say was, so many people come and they say, I ask them, do you exercise daily, especially the females in our country? So they'll say, from morning 6 o'clock till 12, we are running around in the house. We are doing so many activities. We are exercising daily. But then I again have to say, working day and night is not exercise. Exercise is nourishing your muscles. Working from morning 6 to 12, you might be you might be doing activities in which posture is compromised. A difference between a day-to-day chore or a day-to-day activity and an exercise is that exercise is planned, it is in proper postural alignment, and it is prescribed for your specific muscles. That's the difference. So nourishing something and taking work from something, they are two different things, and we need to dedicate a regular timing in our for in our schedule for exercises. That's very important. If you do exercises, you don't need to come to physiotherapist, you don't need to come for any surgery. Yeah.
Absolutely. Well, with the end of the episode, I feel that there are many people who are yet to do or undergo their spine surgery, and they feel motivated towards the rehabilitation process they have to witness ahead. And also, the ones who are undergoing the rehabilitation process, this episode would be really fruitful to them.
One piece of advice which I tell all my patients who are coming from back end, see, if there is a severe nerve compression in your body, please don't delay or postpone your spine surgery. The techniques of spine surgeries have developed a lot. The extent of incisions which were being made in the spine some years back and now today is totally different. Minimal invasive surgeries are there, robotic surgeries are there, which there are sensors attached, during the surgery. If the if a needle is going to hit the nerve, there are sensors. Even before approaching, the sensor would, they would beep. So there are very, very good techniques and good hospitals which have come up with spine surgeries outcomes. So don't be afraid of spine surgeries. The only thing which you need to do is find a good spine surgeon and also a good physiotherapist who can take up your rehabilitation in a very effective and in a very successful way. Yeah.
Absolutely. Well, here I would like to thank you, Dr. Vivek Shrivastava, for taking out time from your schedule and speaking to me and my audience. I really hope you had a great time indulging with my audience and all the viewers and listeners. I hope to see you on board very soon once again.
Sure. Okay, Dr. Anushruti, very wonderful initiative you have taken, and my best wishes for you in
Thank
future
you.
as well.